So you do 4 years of undergraduate medical training, the pre-med training. You do 4 years at medical school, 2 of which are classroom-based and 2 of which are clinical-based in the hospitals. And then you do 1 year of internship. So the internship year has nothing to do with ophthalmology. It's really just general medicine, which does apply to ophthalmology, but you're not learning about the eye in your internship year. You're learning how to work at a hospital. You're in the ER admitting patients, and then you're on the floor with the hospitalists taking care of those patients, and you're working with the cardiologists in the cardiac ICU, in the regular ICU. There's a pediatric rotation. So you really get to see all of medicine as it functions as an entire system before you begin your ophthalmology specific training. And then from my internship year, then it's 3 years of residency. And then from residency training, you can decide to stop there and enter practice as a comprehensive ophthalmologist. And most comprehensive ophthalmologists, cataract surgery is sort of the bread and butter of what we do. But you can decide to proceed with a subspecialty fellowship, and they're 1 to 2 years depending on what you want to study. The main difference is that as an ophthalmologist, I will do surgery. If need be, surgery's not always the fix, but I will do surgery on an eye, and an optometrist will not be doing surgery. They do a lot of healthy monitoring, but also some medical management of some more minor issues, and most importantly, triaging issues with the eye and making sure that any problem is elevated to the correct subspecialist for further care. I don't want to speak for other subspecialties, but I'd imagine that the role an optometrist plays in our care team is very similar to how a nurse practitioner functions in the primary care team, where they're often doing the routine healthy exams and monitoring risk factors, and if something changes or something new comes up and they identify a problem, they know who to send that to for further care. And then they can, once that problem is solved, then they'll resume normal care to make sure it remains stable. Working with optometrists is very important for what we do. A lot of the patients who are sent to me, the vast majority of them are going to be sent to me from an optometrist. The optometrist is providing their routine primary eye care. They're going to see the patient typically once a year. They're going to tweak their glasses, maybe prescribe them contact lenses, and do their routine annual eye exams to make sure their eyes are healthy, that there hasn't been a change, and there might be certain findings that they're following that could be risk factors for them developing a disease, or maybe the patient has a family history of a condition. And so they'll be watching that patient to see if there's any changes. And as long as the patient is healthy and happy and their eyes are stable, generally the optometrist will take care of that patient. So my best advice for patients and family members looking to get eye care, the first step is really to establish a relationship with a local optometrist. And if there's something that's not quite right, or they see a more serious condition, the optometrist is also going to know who to send you to for these specific conditions, because they will have this relationship with their local ophthalmologist as well.